Continuing our conversation now with Daniel Dawes. He wrote the book, The Political Determinants of Health. He is in Atlanta. And Daniel, one of the reasons we got here is because a lot of neighborhoods were forced between accepting the chicken restaurant and the jobs that came with it, but also the bad health that came with that chicken restaurant, the liquor store that also provided a store because it also sold other sundry things that people needed versus no grocery store whatsoever. So how do we fix that without becoming even poorer as communities?
Yeah, that's a really great point. I'll tell you, when you look at public policies in this country, especially the ones that were designed to advance health equity, never have we been able to realize equity-focused policies in this country unless it aligns with a commercial interest and a government investment value. So what do I mean by that? We know that in order to advance the cause of health equity in this country, these commercial interests, which we've seen when you look at manufacturers, when you look at the grocery store operators, when you look at all of these businesses, they tend to, fight hard to keep the status quo. And the only time that we've been able, and we've realized in more recent years, over the last 40 years, 4 major bills, federal bills, that were designed to advance the cause. But again, they had to align with that commercial interest. And so think about the Minority Health Disparities, Research and Education Act, the Disadvantaged Minority Act, and even the Affordable Care Act, right? Even that law had to align with a commercial and a government investment value. So what does this mean? In order to help Black folks in this country, no policy has ever been designed to address just the Black health inequalities without actually including poor whites as part of that package. So those are steps that we need to understand. In addition to that, we also need to understand that what has worked in the past has always been an argument for economic security as well as national security. So if you make that economic argument about how this will help to elevate the Black community, right? Help them to outcompete their global competitors. That seems to have resonated with policy. And then the last piece that we have borrowed and I have seen work successfully is this national security piece. So in the 1940s, when we were going through World War II, there was a national security crisis when you looked at the population group 17 to 24 with young people being unfit for military service. And they saw 20% as a national crisis. But when you come back now in decades later in 2009, right, 60 years almost to the day, we did another study and found that 70% of young people were unfit for military service, owing to higher rates of obesity, again, because of these liquor stores and these bodegas and others that you mentioned, right, not selling healthy food options. But we also saw it because of increase in criminality rates, right, because of drug offenses and the like, and the criminalization of our Black youth. So with all of these now, it became even more of a crisis. And that's what helped us, even under the Obama administration, to fight to get a health equity advancement or priority within the ACA.
Let me ask you.
Yes.
I bring it up because when I was in Africa doing a documentary shoot,
Yes.
I was concerned about the flood of weapons that poured into the African continent. And I asked a man who had lost 11 members of his family whether or not he blamed the American government for flooding Liberia, in that case, with guns. And he said they didn't pull the trigger. Have we reached the point in Black society now where we honestly have to ask ourselves, if nobody is going to fix it for us, we actually have to fix it ourselves by not eating the food that they're putting in front of us, eating less, exercising more, things that we have control over?
I certainly think that is a great argument. It's one lever that we should be leveraging. I'm very pleased to see what's been going on with the protests with Black Lives Matter and pushing on these, with Color of Change and others, pushing on these commercial interests and saying, well, we will not tolerate your efforts to promote ads, for instance, that discriminate against our population group. So yes, I think there is some power that we can use, that we have within ourselves to say, we're not going to spend our money on these products or these services unless you correct your ways. I do think that is a great point. But in addition to that, we know that the political levers also hold tremendous weight. If that weren't the case, we wouldn't have seen over $144 million or billion dollars being spent by the U.S. Chamber of Commerce, over $500 billion being spent on lobbying activities. So we know that the political arena really is the foremost avenue for many of these changes. It can concretize many of the changes that we seek in law and policy. So I would advocate for a strategy, a dual strategy of both, yes, personal responsibility and taking that what we can moving forward, but also leveraging and engaging in the political process so we can concretize these changes.
Daniel Dawes, a reminder to our audience that we control $1.4 trillion in spending power each and every year. So we vote with our wallets. A lot of this will change. I want to thank you for being with us this morning.
My pleasure. Thank you so much.